Hello, everyone. I'm Tom Pearson. I direct the National Center for Deaf Health Research and the Rochester Prevention Research Center. Kim and I are here to provide you with a little announcement that I have, and that a couple of weeks ago, the University of Florida Health Science Center in Gainesville, Florida, has announced my appointment as Executive Vice President for Education and Research in their Health Science Center. This is a marvelous opportunity for me and my family, and an opportunity to carry on a number of the things that we've been doing here at the University of Rochester for the last 16 years. I just wanted to relate to the deaf community that it's been my great privilege and pleasure to be the first director of the National Center for Deaf Health Research. We have accomplished a tremendous amount. We began with this as an idea that we thought was important not only to the university, but also to the Rochester community and to the nation as a whole, and all the deaf persons and their families in our country. And I think we have very much carried out some of those hopes that we wanted to be a national center and be the focus and the center for research in this area. It's been very clear that we are the only research center devoted to the improvement of health and the prevention of disease in deaf persons really in the world. And this has been a wonderful privilege, but it's also been a tremendous responsibility. And it seems like there's never enough that we could do to improve the health of deaf persons, to provide them with health education, to provide them with career opportunities in the health professions. I think one of the main messages that I have is that I will be leaving a very strong, a very unique, and a very successful National Center for Deaf Health Research. And I would begin by saying is that this has been a wonderful team effort. I think any one person who were to take credit for this is obviously totally mistaken. What we've done with this, more than any project I've been involved with in my entire career, has been teamwork. There is no way that we could have accomplished all that we have accomplished without the involvement of the vibrant Rochester deaf community. And it's been my great privilege and honor to work with this community to accomplish all that we've accomplished. Just to look back in the last 10 years or so, we have been able to do so very much in raising the issues that the deaf community faces on an everyday basis. We certainly have been able to provide some opportunities for interface between the hearing and academic communities, as well as the deaf community. We have pioneered information collection techniques which have been culturally appropriate and scientifically rigorous. We have done the first health survey so that deaf people don't basically have a lack of information about what their health needs are compared to the rest of the U.S. population. Many of these are historic firsts. The Deaf WaitWise program, as far as we can tell, is the first randomized clinical trial in deaf persons in history. And it has been such a joy to see the enthusiasm not only of our terrific staff, but also the participants in that trial coming in with such a high percent of the visits, participating, learning, enjoying, staying together after even the trial is over. and as a researcher, this becomes just amazingly happy time for me to see this. I think I am leaving the NCDHR, but again, the NCDHR is going forward at even a greater pace. We have a terrific staff. Dr. Steve Barnett is taking over as director. We have had a stable and very high quality staff. We have involved a large number of other faculty members in the institution. Matt Starr, Bob Pollard, Emil Martina, Nancy Chin, Mike McKee, Scott Smith. We now have several faculty in the School of Medicine who are deaf and use American Sign Language. This is seen nowhere else in the country that I can tell. And this home for deaf health research will continue. They have very nice quarters here in the Saunders Research Building. They have an active participation in the Clinical Translational Science Institute. They are a very important component of our Community Transformation Grant and our Center for Community Health. What we have, I believe, accomplished is to provide a rightful chair at the table for the deaf community, not only in being able to make some decisions, but also to ask some questions that we can then go ahead and answer for the improvement of everyone's health. So I'm going to continue my association with the National Center for Deaf Health Research from afar. I'm going to have many, many fond memories of what we've been able to do here, and I fully expect and certainly will participate in the production of a variety of reports which will get all this very, very important information out to the rest of the world, so that other people who are deaf in other places can reap the benefits of all the hard work done here at the University of Rochester. So thank you very much for all of your support, and just to say is that this is really just the next step in a wonderful voyage for the National Center for Deaf Health Research.